In recent years, the veterinary community has been actively investigating a secondary form of dilated cardiomyopathy, a serious heart condition in dogs. Unlike primary dilated cardiomyopathy, which is often linked to genetics in certain breeds like Doberman Pinschers and Great Danes, this secondary form appears to be associated with diet. Specifically, attention has been drawn to non-traditional diets that are high in pulses, such as peas, lentils, chickpeas, and dry beans, and possibly also potatoes and sweet potatoes. Studies have suggested that apparently healthy dogs consuming these high-pulse diets might exhibit several cardiac changes, including a larger left ventricular diameter, reduced systolic function, elevated levels of a cardiac biomarker called troponin I, and a higher occurrence of irregular heartbeats, known as ventricular premature complexes, or VPCs. Interestingly, some of these changes have shown improvement when the dog's diets were switched. The Irish Wolfhound presents a unique area of interest in this discussion. This breed is known to be predisposed to a specific type of primary dilated cardiomyopathy, called Irish Wolfhound cardiomyopathy, or IWCM, which seems to have a genetic basis. The characteristics of IWCM often include an irregular heart rhythm called atrial fibrillation, an enlargement of the left atrium of the heart that seems disproportionate to the enlargement of the left ventricle, and often only minimal changes in the heart muscle's ability to contract effectively. Given this predisposition to a primary heart condition, the question arises whether diet might play an additional role in the cardiac health of Irish Wolfhounds. While some Irish Wolfhounds with more typical dilated cardiomyopathy findings, similar to what is seen in Doberman Pinschers, have been included in studies investigating diet-associated DCM, it remained largely unknown whether seemingly healthy Irish Wolfhounds consuming high-pulse diets would show any electrocardiographic or echocardiographic differences compared to those on low-pulse diets. Contrary to their initial hypothesis, the researchers did not find significant differences in echocardiographic measurements between the Irish Wolfhounds eating high-pulse and low-pulse diets. This contrasts with some, but not all previous studies in apparently healthy dogs on non-traditional diets, where some studies reported no significant differences in left ventricular size or systolic function. The researchers suggest that these differences in findings across studies could be due to variations in breed or the design of the studies. Interestingly, one cross-sectional study in pet dogs found no echocardiographic differences between diet groups, but did observe that dogs eating high-pulse/potato diets had significantly higher concentrations of a sensitive cardiac biomarker called troponin I,